Hi there. My name is Janine. I'm going to be teaching you today about gestational diabetes in this quick 2-minute video. Basically, gestational diabetes has no cause. It's diagnosed between the gestational age of 24 to 28 weeks. Some patients have symptoms, some do not. If they do have symptoms, it's usually excessive thirst, fatigue. They usually have to urinate a lot, which being pregnant can be missed because a lot of pregnant women have to urinate a lot. And I said that it doesn't have a cause, but the reason women are screened is because obviously it's a condition and hormones likely play a role in it. What happens is women's blood sugars go high and they are not releasing enough insulin from their pancreas to lower that blood sugar. What happens is now you're putting not only yourself at risk, but your baby at risk too, because they are not getting the right amount of insulin for their pancreas to kick into gear after birth. What can happen? You can have a very large baby. You can have a lot of issues if you're not treated for gestational diabetes, like high blood sugar, low blood sugar, hypo or hyperglycemia. It can be very dangerous, and actually it's one of the killers of babies. So if you come in and have a stillborn baby, it could be linked to unstable blood sugars, which is scary to hear, but it's something that can be controlled. So women need to know that this is a very important test during their pregnancy and to not skip it. So what happens is when you get tested, they're going to have you drink a drink that contains about 50 grams of sugar and then test your blood in about an hour. At that point, your blood sugar should be about 130 to 140 in range. And if it's too high, they will have you do a 3-hour test and check those levels to make sure that you're still in a normal range. If you are not, you will be diagnosed with gestational diabetes and have to go on either, depending on your blood sugar levels, a diet plan, a pill that helps with insulin resistance, or actual insulin that you inject in your body. You'll be checking blood sugars all the time to make sure you're in a normal range. And unfortunately, it's something that you can't ignore after pregnancy, because women who are diagnosed with gestational diabetes can go on to have type 2 diabetes as well. So at your 6-week checkup after you have your baby, you will get a blood test called a A1C drawn, and that would tell you if you are in a normal range and if you have type 2. It still should not end there. Then you should follow up with your primary care physician to check your blood sugar yearly at least, to make sure that you are staying in control. If you are diagnosed with it and you do not need meds, they may just do a diet change for you to make sure you're not eating too many carbs and too many sugars, and also to incorporate some exercise into your lifestyle. And sometimes those things alone can really keep your blood sugar at a normal range and therefore keep your baby healthy, because unfortunately it can be deadly to babies, and afterwards their little pancreases need to learn how to release their own insulin and maintain their own blood sugar. So your nurse might in the hospital have to check your baby's blood sugar after the baby's born to make sure your baby has converted over to normal life. Your baby is not born with diabetes. Your baby's born with this, like, the umbilical cord is cut, and your baby has to learn how to live without your insulin, without your diet change. So ideally, their pancreas kicks in gear and adjusts to normal life. But if you are not in good control of your blood sugar, the baby could have some issues, and the baby might need an IV of some glucose to make sure that their sugar level is normal. Usually babies are born with a low sugar if they are having issues, not a high sugar like most patients are, most adult mothers are. So that's a little rundown of what gestational diabetes is and how we screen and treat it during pregnancy. Thanks.